Hello friends, today we learn about the pathophysiology of intestinal obstruction. So, get going to pathophysiology of intestinal obstruction, we know about what is intestinal obstruction. Intestinal obstruction is the surgical condition which interferes with the normal passage of bowel contents along the lumen. Obstruction may occur both in small intestine and large intestine. It may be caused by a mechanical obstruction, paralytic ileus, or impairment of blood supply to the intestine. There are different ecological factors like that the adhesions, the loop of the intestine become adhering to areas that heal slowly or scar after the abdominal surgery and produce the kinking of an intestinal lumen. Next, the intersusception or one part of the intestine slips into another part located below it and intestinal lumen becomes narrowed. Next, in case of the volvulus, the bowel twists and turns on itself and intestinal lumen becomes obstructed. Gas and fluid accumulate in the trapped bowel. In case of the hernia, the protrusion of the intestine through a weakened area in the abdominal muscle or wall and intestinal flow may be completely obstructed. Blood flow to the area may be obstructed. Next, the tumor within the intestine extend into the intestinal lumen. Outside the intestine, the pressure on the wall of the intestine. Intestinal lumen becomes partially or completely obstructed. These all are the causes of the mechanical obstruction. And others, the ACI or the spinal cord injury, vertebral fractures, abdominal surgery, peritonitis, wound dehiscence, GI tract surgery, thrombosis or embolism, these all are the causes of the functional obstruction. And the functional aggravate the neurogenic paralytic ileus, and this is also causes the cessation of peristalsis. And due to this, the mechanical obstruction and the functional obstruction and also the bacterial activity, there are ultimately the gases and the fluids accumulate in the area. And due to this, the borborygmy seen. Borborygmy means there are the absence of the intestinal sound due to the paralytic ileus. And also there are seen due to the mechanical obstruction, there are the increase the contraction of the proximal intestine, and due to this, the severe colicky abdominal pain occur. And due to this, the increase the contraction of the proximal intestine and distension of the intestine, there are the increase the intraluminal pressure and increase the secretion into the intestine, and also the persisting vomiting, loss of hydrogen, ion, potassium, and ultimately the metabolic alkalosis happened. And due to this, the increase intraluminal pressure and increase the secretion into the intestine, and also the bacterial activity goes to here. The compression of the veins and increases the venous pressure and decreases the absorption and edema of the intestine. And due to this edema of the intestine, there are decreases the arterial blood supply and compression of the terminal branches of mesenteric artery. And due to the decrease the arterial blood supply, there are ischemia and anoxia occur. And there are seen the necrosis, and due to this necrosis, the perforation of the necrotic segment, and also from this the bacterial activity, there are the bacteria or the toxin leak into where the perineal cavity and the blood supply, and the peritoneal cavity through the peritonitis and blood supply, there are the bacteremia and septicemia happen. And from the necrosis, there are the gangrenous intestinal wall and ultimately cessation of the peristalsis and decrease the bowel sound. And if the untreated the child with the peritonitis, bacteremia or septicemia, ultimately death occur to the child.